Good morning. I guess it's time to start. So for those who don't know who I am, and which is maybe all of you, I've been a veterinarian for almost 50 years. I was trained at the Ammo Medical Center, did a fellowship at New York Hospital, Cornell Medical Center, was at the Ammo Medical Center for 32 years, and about now 15 years ago, I started my own practice on the Upper West Side, the Animal Endocrine Clinic. At this time, most of my practice is treating cats with thyroid disease, mostly hyperthyroidism, and mostly cats with radioiodine. So I see many, many hyperthyroid cats, some easy to diagnose, and some not so easy. So this morning, I'm going to talk about diagnostic testing. This afternoon, I have a session on what's the best treatment, where I'm going to go through a bunch of case reports of different examples of easy ones and what to look for and so forth. So the title is More Than Just T4, because I see a lot of people just looking at that number, and I hope when this is over, you're going to realize that there's more than just the thyroid level to look at. So when we diagnose, we're looking at sigma history, thyroid palpation, and thyroid panel, and maybe thyroid imaging, which we have at our practice. Many people don't realize that a high T4 doesn't always mean hyperthyroidism, especially if it's only a little high. That can be false positive. Free T4 is frequently false positive, not infrequently. So looking at the sigmoment, hyperthyroidism is a very common disease. About 10% of cats over 9 or 10 will develop this disease. So it's not rare at all, it's very common. So after 10 years old, most of us are screening for hyperthyroidism, which is a good idea to do. But we also have to pay attention to the history. These cats almost always lose weight and almost have a good appetite. So if a cat comes to you and is not eating or isn't losing weight, you have to take it with a grain of salt when you look at your thyroid values if you do them. Because many of these cats are picked up just on annual screening, and you may have a little high T4, but they don't have any clinical signs. And certainly what we want to do is come back and feel for a nodule. Here's just some cats eating well. They love to eat. They're not anorexic, that's for sure. And I had sound with this, which is not coming up, but anyway, this cat loved to eat. So here's another cat. This cat ate well, lost weight despite a good appetite. And to get this photo, I was by myself, and I would put a can of food down and come back and take a photo, and it took 8 cans of food to get this photo, because he kept eating the cans so fast. But as I mentioned, many cats today aren't that thin, they haven't lost weight, they're very mild, and they really don't look very hyperthyroid. You know, they're not thin, they're doing well. So according to when we first saw the cats with the disease in the early 1980s compared to now, it's a whole different spectrum of disease that we're seeing. So most cats that we see are quite mild. So on physical exam, we're looking for a number of things. First of all, we're looking at the body condition score. These cats should be losing weight if they're hyperthyroid, at least as they get more advanced. So we're looking for thinness, we're looking for a thyroid nodule, and most of these cats will start to develop muscle wasting. The muscle loss will occur before the fat loss. So they can have a body condition score of 6 or 7, so they're actually overweight, but still have lost weight, and that's due to the muscle loss. So low body condition score, muscle wasting, and with earlier mild hyperthyroidism, this is a cat with a body condition score of 5 out of 9, so that's an ideal body condition score. There's plenty of fat there, but when you look at the muscle condition score, there's some mild to moderate muscle wasting. So body condition score, I'm sure you're all familiar with how to do it. Muscle condition score in cats, what I normally pay most attention to is I take my hand and I go over the back, spine, and feel, and you can kind of feel for muscle loss there. And then certainly over the, and certainly over the hip area and so forth. So here's a cat with more moderate hyperthyroidism that has a body condition score of 3, so he's quite thin, and he has more severe muscle wasting. And here's a cat that's really thin, that has profound muscle wasting. So body condition score and muscle condition score tend to go in parallel as the disease becomes more serious or more severe, because they lose a muscle first, and then that muscle loss continues with hyperthyroidism, and then the fat comes later, the fat loss comes later. So this is a study we did a few years ago where we looked at 462 untreated hyperthyroid cats and looked at their body condition score, and only about a third of the cats are really considered thin, and that's kind of held true today. We certainly see cats that are thin, but most of the cats we see today are of normal weight or even obese. But when you look at the muscle condition score, and we score these on a 4-point system where 0 is severe, 1 is moderate, 2 is mild, and 3 is normal, you can see that about 75% of the cats have muscle wasting. So again, the loss of muscle mass from hyperthyroidism occurs before the loss of fat in these mild cases. And then we did a follow-up study where we used ultrasound to measure the muscle over the back. And you can see the epaxial muscle height compared to normal. About 65% of the cats had a low thickness of the muscle over the back, over the epaxial muscles. And after we treated them, this muscle tends to come back. It almost always improves. So by treating the hyperthyroidism, we're going to increase that muscle mass. And you probably are aware now of all the articles about people with sarcopenia that this is a bad thing to lose too much muscle mass. So just know that by treating these cats, we can get the muscle back at least to some degree, and many of them go back up into the normal range. Thyroid palpation. Now, I hear every week from veterinarians that say that they don't bother trying to palpate thyroids because they can't do it. They never feel anything. And I don't know what to say other than you have to be patient. You have to be patient and you have to be careful. Some of these cats aren't in the best mood when they're hyperthyroid, so that's something to think about. The first thing to do, and the first thing I do, is all of my cats on my exam table go into, there we go. All of my cats go into a basket. So if you don't have a basket, that's what I'd recommend, because they come out of their cat box, they go into the basket. I have a towel in there, and they're relaxed, and they tend to kind of snuggle in there and relax. Okay, that's number one. I like that. Or you can take the top off the carrier and do it that way. But it helps with these cats in general. The second thing I do is I never face the cat when I'm examining them. You can see here the owner's to the left, I'm to the right. I'm examining the cat from the back because that's less threatening to these cats. Then there's basically 2 ways to palpate. You can use the classic thumb index finger where you put the head in various degrees of flexion and extension. You start by the level of the larynx, go on either side with your thumb and forefinger, and you're being gentle, but you're palpating for the slip or the blip as it goes through under your fingers. Sometimes this is easy to feel. It takes a second in most cases. And the other thing to do is I go down, I also kind of palpate up. because if they're kind of down the thoracic inlet, sometimes you have to push them up to feel. So here's an example of this. So we're palpating, and you probably can't see, but there's a little blip right there on the right. But what I want to show you here mostly is look at the tail. See how that tail's starting to go? That means it's time to stop, right? Give the cat a break, otherwise he's going to be upset. And these cats tend to be more irritable and they're harder to examine without getting upset. So just remember, if they're hyperthyroid, it's not their fault. If they're fractious, it's not their fault. When they come in for a recheck, they probably will be in a much better mood, much easier to examine. So the other way to examine is to use one finger. So with this, I stand it back, and you can use whatever finger you want, but I'm right-handed, and I use this finger. I use my middle finger. So I take the cat's head, and I turn it to the right. Again, you can put it in different degrees of flexion and extension, but generally just relax. And I'm feeling in the left groove for a thyroid nodule. I go down, start high, and go down to the thoracic inlet, and then turn the tap the other way and go on the other side. So you're feeling away from the groove. So here we're feeling the left side, we have the cat's turn to the right. Here we do the right side, we have the cat's, or the other side, and we do it that way. So here's an example of this. Here we're feeling, boop, you can see it goes through. So it helps sometimes to see if you shave, but we usually don't need to. So if you have a cat that's clearly symptomatic for hyperthyroidism and you get a high T4 and you don't feel a nodule, sometimes that happens. Sometimes they have a nodule that's falling into the thoracic inlet, or it can even be an ectopic nodule in the chest. I'll show you some examples of that in a little while. But usually it's pretty clear cut. If you have a cat with borderline or only a high free T4 and a normal T4 and you don't feel a nodule, to me you don't have a diagnosis. To me you need more than one piece of evidence. So if you can't feel a nodule, and sometimes you can't in these mild cases, even when they really are hyperthyroid, I would never start them on methimazole or refer them for retiwidine or certainly do surgery or YD or anything. And we'll talk about these treatment options this afternoon. I wouldn't do anything until we confirm it. And usually if there's any doubt, I like to do a T4, free T4, and TSH. And we'll be talking about that very soon, just to confirm the diagnosis. We're going to talk about it now. So total T4 is a very, very good screening test, as you know, right? So it diagnoses 95% of all hyperthyroid cats with one single test, right? So it's a good test, it's cheap, and that's what everyone looks at. They look at the T4. But just remember, in this study, we looked at 917 hyperthyroid cats, and we looked at, I have to remember here, we looked at cats, 32 cats suspected of being hyperthyroid that weren't, and then we looked at a bunch of normal cats. So you can see both this suspect and the normal cats, there's cats that have T4 values that are slightly high. Okay, so you can say, well, how can that be? How can a normal cat have a high T4? Well, that's simple, because when we establish normal range for normal cats, what we do is normally try to find about 125 or 150 clinically normal cats that we don't think are hyperthyroid. And at our clinic, we've done this using cats that we've done thyroid scans on for different purposes. Sometimes they were, or in the early days, we did this with cats. We would make deals with clients. I had one owner who had about 30 cats at home, and I said, listen, if you bring those 30 cats into me, we'll do CBC, vet screens, and panels, and everything, urinalysis, all for free if you let us do a thyroid panel and do a thyroid scan to show that they're normal. So we got many normals like that. So anyway, we did these cats, and what you do with the data, you get this range of values, and you put it in percentiles, and you throw out the upper and lower 2.5%. That's standard way to do normal range or reference interval. It's normal range. But these cats were normal, right? They were just outliers. They were unusual normal cats, but they were still normal. So just having these normal cats that have slightly high values or slightly low values doesn't make them hypothyroid or hyperthyroid. They're normal. All cats and all people, we all have our normal range for T4. Some cats have a higher value than others. Some cats are always high normal and some cats are always low normal, but they're still normal. So this idea of a reference interval is the population reference interval or population normal range. It's not that cat's normal range. So that's kind of an important thing to remember. You can't always look at the number. You have to look at the cat. You have to get a history. You have to talk to the owner. So, and the same here is true for these suspect cats. These cats, we thought they may be hyperthyroid. They had some signs consistent with it. We worked them up and determined they had something else, not hyperthyroid. And some of them had a slightly high T4. Not very many. Again, it would be about 2 or 3%. So you can say, well, I know, I'm going to do a T3 or something. Well, the same thing is true with T3, but T3 overall for diagnosis isn't as good because cats tend to have a normal T3 more often. And why is that? That's because the hyperthyroid cat is trying to protect itself. It says my T4 is high, the tumor is making T4, I'm doing my best not to have clinical signs, and one way I can do this is block the conversion of T4 into the more active T3. So the T3 levels aren't always as high, and when they are high, the cats are usually more severe. So we don't routinely run T3. I run a lot of T3s because I use T3 as part of my dosing regime when I treat with radioiodine, because again, the higher the T3, that reflects a more severe state of hyperthyroidism, and we have to give it a little more radioiodine. So I do it, but do I recommend routinely doing T3s? No. How about free T4s? You can say, well, free T4 is supposed to be a better test, it works better, it's going to diagnose more, and it indeed does. Remember hyperthyroid cats, the T4 was about 95, and this is, different studies show 96, 97, 98% will have a high free T4. So you can say, well, this is great, this is a better test. The problem is, even though it's more sensitive, in other words, we're going to diagnose more cats, it's less specific. So what this means is if you look at this group, there's a large group, about 25% or so, or let's say 15 to 25%, that will have a falsely high free T4. So you can have a falsely high free T4 in cats with a normal T4, a high normal T4, or even a low or a low normal T4. So just finding a high free T4 alone is great. It goes along with hyperthyroidism, but just remember there's a lot of false positives. So because of this, I like to do it just when I do my panels. If I do a T4, a free T4, a T3 TSH, the whole thing is helpful. But just looking at it by itself, it's not. And again, the same thing I talked about the T4, we established normal range for free T4. We automatically have 2.5% of cats in each end that are high or low, the way we establish our reference interval. So TSH levels, normally there's this negative feedback to systems where T4 and T3 are secreted by the thyroid. When those levels get to a certain point where the pituitary thinks is appropriate for the cat, the pituitary TSH, that'll feed back to the pituitary, shut off TSH secretion. TSH will fall. With falling TSH, that means that T4 and T3 will also fall back to normal. And that's how the normal levels are regulated throughout the day. With hyperthyroidism, there isn't a normal thyroid, there's a thyroid tumor. All these cats have a thyroid nodule. You can call it a tumor, which just means swelling. They all start as being hyperplastic and then become adenomatous nodules. So by the time we diagnose hyperthyroidism, if you look pathologically, these cats have one or more thyroid nodules, which are adenomatous, right? And they're surrounded by a capsule, and there's areas of normal tissue usually between. So we're going to say they're an adenoma. So this cat has a unilateral nodule, and what's happened is the T4 and T3 are gone up because he has a thyroid tumor. It feeds back to the pituitary. The pituitary says, holy cow, I got to shut off TSH. I got to shut it off because we have too much T4 and T3, so it's trying to protect the body. So TSH goes down, it decreases, but that doesn't matter. The tumor doesn't care because the tumor doesn't need TSH. The tumor is autonomous. It's an autonomous adenoma. It's going to make T4 and T3 no matter what the TSH is. But without that TSH in this cat with this unilateral tumor, the other side is going to atrophy. So you'd expect the other side to atrophy. So I'll show you on thyroid scans, if there's a unilateral tumor, the other side, it should be suppressed. In very, very early cases, however, when we first diagnose this TSH may not be totally suppressed, and the contralateral lobe may not be totally suppressed or shut off. And we want to avoid, if any of you treat with radioiodine, we want to be careful in those cats, because those cats, if we treat them too early, they will become hypothyroid almost invariably. So we want to hold off a little while and let the disease progress a little more. So this idea that we're going to be in a rush to make the diagnosis and refer them all for therapy. If you've referred to me, some of you may know that I'm going to tell you to, let's just monitor and do nothing for 3 months and let the disease get a little worse before we treat. More about that this afternoon. So, this whole idea about TSH, if you go to your doctor and you say, and the doctor says, I think you may be hyperthyroid or you may be hypothyroid, one thing they'll do is measure TSH. And this is the thyroid test of choice. They may not even do a T4. They may not do a free T4. They may only run a TSH. TSH is the test of choice. And finding a low TSH in a patient with hyperthyroidism is a more sensitive test than T4. So they can diagnose emerging hyperthyroidism very, very well. So we have a ways to go. Until recently, the only TSH test we had was an old dog TSH assay that first came out in the late 90s. And it's not a very good test for dogs, but it turns out it's a okay test for cats. It's a chemiluminescence assay, which is an Imulite you may have heard of. It's on the chemistry machine, so it's easy to do. And you can see, that normal cats are in this range, and you can see, first of all, that almost half of the normal cats will have, quote, low values. It's not low values. The detection limit of this assay is 0.03. So the problem with this assay is it's meant for hypothyroid dogs where the TSH level goes up, so it can't very well measure very, very low or suppressed values. It's not very good at that. But you can see that this was 917 hyperthyroid cats, and you can see there's not very many dots there. There's certainly not, there's way less than, how many are there? So only 18 dots. Only 18 of 917 were measurable. So if you have a cat that's mild, we think that the cat may be hyperthyroid, the T4 is a little high, you can feel a nodule, and you measure TSH by Imulite, and it's measurable up here, it's much less likely that that cat is hyperthyroid. Still possible, it could just be very early. But most of these hyperthyroid cats should have an undetectable TSH because remember, the T4 and T3 are feeding back to the pituitary and shutting off TSH secretion. And this shows a study we did looking at normal cats where we measured 10 cats and we measured their T4 and TSH values every week for, I think it was 7 or 8 weeks or something like that. So anyway, so you can see that just looking at this, cat 1, most of the values were in the low normal range for TSH. 1 was low. In this cat, about half and half. And cat number 3, every week that we measured, the TSH was undetectable. And you can see, here's a cat that all the values were low normal. These are both normal. Here's a cat where all the values are high normal. Okay, so each cat has their own reference interval for T4, T3, free T4, and TSH. So you know, if you have this cat that's here, the TSH will always be suppressed, so that we can't diagnose hyperthyroidism based on that alone. So, of these cats that were hyperthyroid in this study, most of the cats that had detectable levels, as expected, had very mild hyperthyroidism. They weren't real severe, so they were this mild group. So if you look at sensitivity and specificity, T4 alone isn't too bad. It picks up most hyperthyroid cats and it's rarely false positive, but it can be. Free T4 is a little better with sensitivity, but a little worse with specificity. TSH is very sensitive. Almost all hyperthyroid cats would be low, but remember about 1/3 of clinically normal cats with this Immulite assay will be suppressed too, so you can't differentiate between hyperthyroidism and normal, so that makes the specificity lower. So if we're going to do this, we like to combine tests. So we like to do a whole panel basically, which improves the specificity. It makes it a little bit easier. So serum TSH can be useful. I measure this in all my cats when I'm going to treat with radioiodine because I want that TSH to be suppressed before we give radioiodine. If it's not suppressed, that means any normal tissue that's left will not be shut off, and that TSH, the circulating in the circulation, will drive that radioiodine into the normal tissue, and that leads to increased hypothyroidism. But remember that many normal cats, about 1/3 of normal cats, will have undetectable TSHs when measured this way. Now you may, here we're going to skip this. You may have heard about this machine. There's a booth out here, so Medica has a booth, so you can talk to them. This is an in-clinic machine that you can run a number of analytes on, but what I'm interested in, the reason I have one of these in my clinic is to measure T4 and TSH. And I'm especially interested in TSH. This uses a different assay, bulk acoustic wave, not that what is that? Honestly, I don't really understand it, and I don't think you have to know. You can read about it, you can talk to them. But this is a feline assay. It's actually a canine assay that's been tweaked to work better in cats. And it measures lower. So we wrote this up. This is about a year ago. This is the American Journal of Vet Research. We looked at we compared this assay to the chemilumin assay, the Immulite assay. So here, I'm just going to skip this, and we're just going to show you the data. So here, these are T4s, just to show you. We did a number of cats in this study, and I just wanted to show you. Here's clinically normal. They have thyroid levels that are basically normal. Subclinical hyperthyroid, so they're very mild hyperthyroidism. Mild hyperthyroidism, moderate, and severe. So as the thyroid disease gets higher, gets worse, the T4 goes up as expected. So how did we classify? We did this based on thyroid tumor size, how bright the tumor was on thyroid scan, what their T3, T4 levels were, and so forth. So, but you can just see that looking at these cats, the T4 and T3 went up. When you look at the chemiluminescent assay, this is the Immulite assay we've been talking about. In these groups, as we see, here's the normal cats. As you can see, the levels start to go down with time as the thyroid level becomes more severe. But the problem is almost all of the cats have very low undetectable levels, so we can't really differentiate hyperthyroid from normal. When we look at the Zomedica or the Truforma results, this bulk acoustic wave method, things are a little different. Here's subclinical, mild, moderate, severe. So you can see the disease is getting more and more severe. You can see these subclinical ones, there's a number that still are normal because they're just starting to become hyperthyroid. They have no clinical signs, their tumor is tiny, and so forth. Whereas it gets mild, moderate, and severe, now we can see the values are low. And remember that normal Immulite values, the cutoff is way up here, right? It's way up here. It's at 0.03. This is a semi-log scale. So these are clearly lower. So we can now, with this machine, actually measure low values. And we continue to do hyperthyroid cats, and with this machine, they're almost always undetectable, which is not less than 0.03 like the Immulite machine, but less than 0.008, very, very low. So this is a breakthrough really for diagnosis. So you could probably diagnose hyperthyroid cats with this, or you could, with this sooner than you could with the T4 value. Now, should you be treating those cats that early? That's another debate. We'll talk about that this afternoon. I would say in most cases we shouldn't. So thyroid imaging, we use routinely. We'll go through this quickly. What's nice about this is like the gold standard diagnosis. It really tells you, does the cat have a tumor or not? Where is the tumor? So we can say if it's unilateral, bilateral, asymmetric, where they're asymmetric or bilateral. We can detect ectopic tumors in the chest. We can detect thyroid cancer, where there's multiple nodules, they're huge, they're in the chest and everything else. We can kind of stage a thyroid disease. This is just a thyroid tumor that we took out. And I want to say a few words, just a few things about hypothyroidism. This is everything about hyperthyroidism. Hypothyroidism, there's three main causes. By far the most common is iatrogenic, what we do after radioiodine or surgery, or too much methimazole, by far. But we can see congenital hypothyroidism, and there's a couple hundred cats almost reported now in the literature, so there's quite a few. Most of these cats have goitrous hypothyroidism, or they have a little nodule as they grow older. Those cats usually are dwarfed and so forth. They're easy to diagnose. We now have about 20 hypothyroid cats that are adult onset, where they're not diagnosed until later age, older than a year. So by far, and what I want to concentrate is iatrogenic. The problem with these cats is that being iatrogenic hypothyroid, many of the cats don't have overt signs of hypothyroidism, but this chronic hypothyroidism that goes makes renal disease worse. So if they have if they have underlying renal disease, their renal disease will progress faster. So we want to detect and do it. So in these cats, we're after they get treated with surgery or radioiodine for sure, and maybe methimazole, we're looking for we're measuring T4 and TSH, so a low T4 and a high TSH value, remember it's just the opposite of hyperthyroidism, we could classify that as overt hypothyroidism. And many of the cats, their T4 will remain low normal, but their TSH goes up. So that just means they have less severe hyperthyroidism. So the overt cats, of course, have a higher incidence of clinical signs, and they have more azotemia. And so the main thing we're really worried about the hypothyroidism, but mostly because of the azotemia that will be progressive. So when we look at these cats, sometimes the owners say they're lethargic, and you can see they may have a scruffy hair coat, but most of them look pretty normal. This is a cat that came into me, the only cat I've seen like this, where it really has endocrine alopecia. Most of them don't really have, they have shedding or matting, but not alopecia. And many of these cats, this cat has overt, he looks completely normal, overt, completely normal. The owners are very, very happy with their progress. So should we treat these? And usually what I do is monitor a little bit, and if they stay overt, I treat them. If they're subclinical and they're not becoming azotemic, we monitor them because many will go into remission, but it may take a year or two for them to revert back to euthyroidism. So we just want to monitor them. So we're looking for these same thyroid values. And I just want to show you the study quick we did. This was a study where we looked at hypothyroid cats based on thyroid scan compared to euthyroid cats and cats with kidney disease. So we looked at T4, and about half these hypothyroid cats had a low T4, but the same was true for cats with kidney disease, because non-thyroidal illness can lower the total T4. So a T4 alone isn't good enough. So we can say, well, let's look at free T4s, that'll be better. Well, it turns out in cats, free T4 may be a better test to diagnose hypothyroidism in dogs, but it is not in cats. It's not. So I don't really even bother looking at free T4 after we treat these cats because it rarely is all that much. It doesn't tell you anything more than the T4 does. But when we look at TSH, these cats, and this is with the Immulite assay, but the same would be true with the Zomedica Truforma assay, these cats almost invariably will have a high TSH level. So it's easy to diagnose hypothyroidism in these cats just by monitoring TSH. So when any cat that's been treated with radioiodine should have, we do our sampling at 1, 3, 6, and 12 months to monitor T4 and TSH. And again, if there's overt hypothyroidism or azotemia, we start treatment with LT4. If it's mild, that we'll just monitor them to see if they're not azotemic. So TSH test, it's very important to look for hypothyroidism. It's a much better test than T4 in these cats. And then treatment, I just want to show you after treatment, we expect the T4 and free T4 to go up after we supplement these cats. And as we supplement them, we want the TSH and creatinine to fall. They may not normalize, but we want them, they are almost, you can see that our goal is to measure post-pill T4 and TSH. We want that TSH normal too. So, that's it. Thank you very much. I'm happy to answer any questions.